Welcome to the Spanish Medical Interpreters online class. We are happy to have you all here. Let's first review the learning objectives for this class.
Learning objectives. In this lesson, we will be able to recognize and write the functions of the peripheral nervous system, recognize and write the meaning of receptors in the peripheral nervous system, list and recognize the names of the special sense organs, write and recognize the brain's interpretations of the special sense organs, and recognize and write the meanings of Chapter 14, word parts, and use them to build or analyze terms. In this lesson, we will also learn to write terms for selected structures of the sense organs, or match terms with their descriptions, write the names of the diagnostic terms and pathologies related to the special sense organs, match surgical and therapeutic interventions in Chapter 14, and write the names of the interventions when given their descriptions, and correctly spell terms pertaining to the special senses.
Hey there, students. Ever wondered how you're able to see, hear, taste, smell, and touch the world around you? It's all thanks to your special sense organs, part of your peripheral nervous system. Today, I'm going to take you on a deep dive into how they work. Let's start with your eyes. These are your windows to the world. Light enters through the cornea, passes through the lens, and hits the retina at the back of your eye. The photoreceptors in your retina rods and cones convert light into electrical signals. These signals are sent via the optic nerve to your brain, which processes them into the images you see. Next up, the ears. They're not just for hearing, but also for balance. Sound waves enter through the outer ear and make the eardrum vibrate. These vibrations travel through the ossicles in the middle ear to the cochlea in the inner ear. The cochlea's hair cells convert these vibrations into electrical signals sent to your brain. That's how you hear sounds. And for balance, the semicircular canals in your inner ear detect movement and help keep you steady. Moving on to the nose. Smell is a powerful sense. When you sniff something, odor molecules bind to olfactory receptors in your nasal cavity. These receptors send signals to the olfactory bulb at the base of your brain. Your brain interprets these signals as different smells. Fun fact, your sense of smell is closely linked to memory and emotion. Now, let's talk taste. Your tongue is covered in taste buds, tiny structures that detect sweet, salty, sour, bitter, and umami flavors. When you eat, molecules from your food bind to receptors on your taste buds. These receptors send signals through gustatory nerves to your brain. That's how you enjoy the flavors of your favorite foods. Last but not least, the skin. It's the largest organ of your body and packed with receptors for touch, temperature, and pain. When you touch something, mechanoreceptors in your skin are activated and send signals to your brain. That's how you feel texture and pressure. Thermoreceptors detect changes in temperature, while nociceptors signal pain. So, there you have it. Your special sense organs, eyes, ears, nose, tongue, and skin, work together to help you experience the world. They detect sensations and send signals to your brain, turning them into sight, sound, smell, taste, and touch. Pretty cool, right? Next time you see, hear, smell, taste, or touch something, take a moment to appreciate the amazing biology at work. Thanks for tuning in. Don't forget to like, subscribe, and hit the bell icon for more awesome content. Catch you later.
The eye is the most complex sense organ. The eyebrow, eyelashes, and eyelid prevent foreign objects from entering the eye. There are 3 layers of the eye. The conjunctiva is the mucous membrane that lines the eyelid and continues transparently over the eyeball. The sclera is the white part of the eye. The sclera is in continuum with the cornea, but separated from it by the corneal limbus. The iris, or colored portion of the eye, consists of smooth muscle around the central opening, or pupil. The iris adjusts the diameter of the pupil, regulating the amount of light entering the eye. The lacrimal apparatus consists of a lacrimal gland that forms tears. Tears drain through lacrimal ducts to lubricate the surface of the eyeball. Tears then drain into lacrimal canals, which drain into a lacrimal sac. The nasolacrimal duct drains tears into the nasal cavity. Tiny extrinsic skeletal muscles are attached to the sclera and move the eyeballs. 3 layers of tissues and components form the eyeball. As shown previously, the most anterior portion of the eyeball consists of the sclera and cornea. The sclera forms the globe shape of the eye, and the anterior portion is referred to as the white of the eye. The cornea is avascular. The middle layer of the eyeball wall includes the choroid, ciliary body, and iris. The choroid is the highly vascular, pigmented portion on the internal surface. The ciliary body is anterior to the choroid and posterior to the iris. It has suspensory ligaments that hold the lens in place. The ciliary body connects to the lens by the suspensory ligaments and is composed of ciliary muscles that contract and relax to change the shape of the lens. The retina is the innermost coat of the eyeball. It has no anterior portion. Retinal blood vessels supply the retinal tissues and are critical for normal visual function. The pigmented retina is composed of melanin-containing epithelial cells next to the choroid coat. The sensory retina contains photoreceptor cells called rods and cones because of their shapes. It also contains bipolar cells and ganglion cells. The rods and cones are photoreceptors because they are sensitive to light rays. The bipolar cells receive nerve impulses from the rods and cones and pass them to the ganglion neurons. The ganglion neuron axons extend to the optic disc to form the optic nerve. The optic disc contains perforations through which the fibers emerge from the eyeball as the optic nerve. The posterior cavity contains the vitreous body, a sac filled with a soft, watery gel. It, along with the aqueous humor, helps prevent the eyeball from collapsing. It is anterior to the lens. The anterior cavity of the eyeball has 2 subdivisions: the anterior chamber in front of the lens and the posterior chamber between the iris and the lens. It is anterior to the iris between the iris and the cornea. Aqueous humor is formed from blood and ciliary body capillaries. It is secreted into the posterior chamber and moves through the pupil into the anterior chamber.
The eyes are the paired organs of sight. Structures of the eye include the pupil, a dark circular structure in the center of the eye. The iris, colored portion of the eye can be blue, green, brown, gray, etc. The sclera, tough, white opaque membrane that covers the eyeball. The accessory organs, muscle, fascia, eyebrows, eyelids, and conjunctiva. The mucous membrane that lines the inner eyelid. The lacrimal structures, lacrimal glands and ducts, the nasolacrimal sac and duct.
The cornea refracts or bends the light rays as they pass through the lens. The choroid is responsible for a blood supply to the eye. The ciliary body secretes vitreous fluid and helps change the shape of the lens. Ocular muscle moves the eyeball. The eyelid's closing protects the eye. The iris controls the size of the pupil by contracting or relaxing, which determines the amounts of light entering the eye. The lacrimal glands secrete tears to keep the eye moist.
The lens refracts light. It becomes flat for distant vision or rounded and thick for near vision. The optic nerve transmits visual information to the brain. The retina changes optic signals into optic impulses. Sensitive receptor cells of the retina, called rods, are responsible for peripheral and night vision and detection of motion. Cones function in bright light and are responsible for color and central vision. The sclera protects the eye. As we mentioned before, the retina has sensitive receptor cells called the rods and cones. Rods enable peripheral vision, seeing at night, and motion detection. Cones are photoreceptor cells that enable visualization of colors. Daltonism is a weakness in seeing colors distinctly, usually affecting either the green or red cones. Total color blindness is called achromatic vision.
Let's review some combining forms for the eye. Choroido stands for choroid. The adjective is choroidal. Remember that the suffix -al means pertaining to, and in this case in particular, it means pertaining to the choroid. The same applies to the rest of the adjectives that we will review in this section that end on -al. Conjunctivo means conjunctiva. Its adjective is conjunctival, which means pertaining to the conjunctiva. Corneo and cerato mean cornea, and the adjective is corneal. Iro and irido mean iris. Its adjective is iridic. Lacrimo or dacryo mean tear, and the adjective is lacrimal. Oculo and ophthalmo mean eye, and the adjective is ocular. Opto and optico mean vision, and the adjective is optic. Pupillo means pupil, and the adjective is pupillary. Retino means retina, and the adjective is retinal.
Quiz time. Which eye structure contracts and relaxes to determine the amount of light let into the eye? A. Cornea. B. Retina. C. Iris. D. Lens. One volunteer at the time, please.
Let's review the difference between ophthalmologist and optometrist. Optometrists treat visual problems such as nearsightedness or farsightedness, and ophthalmologists are medical physicians who treat other pathologies of the eye. For example, when you need to check your vision and get a new pair of prescription glasses, you go to the optometrists. But when you have glaucoma or cataracts or need any kind of eye surgery, that's when you go to see an ophthalmologist. Let's review some diagnostic procedures for the eye. The Snellen chart is the eye chart with the big E that you have likely seen. It is a common method of determining clearness of vision. It compares one's visual performance with that of an individual with statistically normal 20/20 vision. Assessment of visual fields determines the physical space visible to an individual, often performed with the subject's head remaining stationary and telling the examiner the number of fingers he or she is holding up at the outer periphery of one's vision. Tonometry measures intraocular pressure. Ophthalmoscopy is examination of the interior of the eye and is performed with an ophthalmoscope. Slit lamp examination looks at the various layers of the eye with a bright light, usually after dilation of the pupils. Fluorescein angiography uses a bright green fluorescent dye, fluorescein, to examine blood flow through vessels of the eye. Accommodation reflex is the ability of the eye to adjust to variations in distance. Test yourself. Look at a distant object for a minute and then see how quickly your eyes adjust to be able to read small print. Let's review diagnostic terminology of the eye. 3 common irregularities in vision are refractive disorders. That happens when the lens is unable to focus an image accurately on the retina. In this picture, you can see the graphic description of the 3 most common vision irregularities. Myopia is nearsightedness. It happens when parallel rays entering the eye are focused in front of the retina. Hyperopia is farsightedness, or in other words, is the inability of the eyes to focus on nearby objects. Rays of light entering the eye are brought to focus behind the retina. Hyperopia, also called presbyopia, when this kind of impairment of vision is due to old age. And astigmatism is uneven focusing of the image, resulting from distortion of the curvature of the lens or cornea. Welcome to my club.
The front part of the eye, which includes the back of the cornea, the lens, and the iris, is continuously bathed in a fluid called aqueous humor. This fluid is produced by cells on the ciliary body around the lens and moves around the front of the lens, through the pupil, and into the space in front of the iris. It is absorbed at the open angle of the cornea and iris. Glaucoma is a group of eye diseases that leads to increased intraocular pressure and damages the optic nerve. Chronic open-angle glaucoma is the most common type. In chronic open-angle glaucoma, drainage of aqueous humor from the eye decreases. Over time, the buildup of this fluid puts pressure on the lens, and this pressure is transmitted to the back of the eye. Pressure on the nerve cells of the retina, or on the blood vessels of the retina, permanently damages the retina. The peripheral retina is usually damaged first, causing a loss of peripheral vision. If left untreated, glaucoma can lead to blindness.
Additional disorders of the eye. Conjunctivitis is an inflammation of the conjunctiva, also known as pink eye or red eyes. Glaucoma is an increased pressure within the eye. Macular degeneration is a progressive deterioration of the retina associated with new vessel formation. Ptosis is drooping of one or both upper eyelids. And retinopathy is any disease of the retina.
Let's review other irregularities of vision. Photophobia is abnormal sensitivity of the eyes to light. It does not mean fear of light. Nyctalopia is poor vision at night or in reduced light.
Quiz time. Which term means increased pressure within the eye? A. Conjunctivitis, B. Glaucoma, C. Macular degeneration, D. Ptosis. One volunteer at the time, please.
In a cataract, the normally clear lens of the eye gradually becomes opaque. Although this change is painless, it can cause visible cloudiness in the lens and blurred, dim, or cloudy vision. This condition may be treated by removing the cataract. After making a tiny incision in the cornea, the surgeon injects an anesthetic and then fills the interior chamber with a viscoelastic gel. Through another incision, the surgeon creates a round, stable opening in the capsule of the lens, then injects fluid to free the lens. Next, the surgeon inserts a phacoemulsification probe. This device uses high-frequency ultrasound to break up the cloudy lens, which can then be suctioned out. Next, the surgeon uses irrigation and aspiration to remove any remaining pieces of the lens before injecting viscoelastic gel again. In most cases, the surgeon inserts a folded intraocular lens, or IOL, into the lens capsule. The IOL unfolds and stays in place to correct the patient's vision. Finally, the surgeon removes the viscoelastic gel and hydrates the incisions, which seal themselves.
Surgical and therapeutic interventions for the eyes. First, let's review some of the surgical interventions for the eyes. Blepharoplasty is surgical repair of the eyelids to repair ptosis. Corneal abrasion is scraping away the outer layers of the cornea, either by laser or with a scalpel. Corneal transplant is transplantation of corneal tissue. Cryoextraction is removal of a cataract with an extremely cold probe. Laser retinal photocoagulation is used to stabilize a detached retina, using laser to make pinpoint scars. LASIK is corneal surgery in which the excimer laser and a microkeratome are combined to correct myopia. Ophthalmic cryosurgery is the use of extreme cold to remove a cataract or to cause the edges of a detached retina to heal. Now let's check some of the therapeutic interventions for the eyes. Ophthalmic agents. These medications are specifically designed to be applied to the eyes. They can treat a variety of conditions such as infections, glaucoma, and dry eyes. It's important to use them exactly as prescribed to avoid any potential side effects. A mydriatic causes dilation of the pupil. Ophthalmic drops, creams, or ointments are used to add moisture, speed healing, and additional uses. Ophthalmic anesthetics temporarily cause loss of feeling within the eyes. Ophthalmic antibiotics treat bacterial infections or are used to prevent infections.
Surgical and therapeutic interventions for the eyes. Video summary: blepharoplasty, corneal abrasion, corneal transplant, cryoextraction, laser retinal photocoagulation, laser-assisted in situ keratomylosis, LASIK, ophthalmic cryosurgery, ophthalmic agents, mydriatic, ophthalmic drops, creams or ointments, ophthalmic anesthetic, and ophthalmic antibiotics. These were all the topics discussed in the previous video.
The shape of the cornea and eye affect refraction. In a normal eye, light enters through the cornea and focuses on the retina, resulting in clear vision. In myopia, or nearsightedness, light focuses on a point in front of the retina. In hyperopia, or farsightedness, it focuses on a point behind the retina. And in astigmatism, it focuses on more than one place. By reshaping the cornea, laser-assisted in situ keratomylosis, or LASIK surgery, can correct refractive errors. After administering a topical anesthetic, the surgeon inserts a speculum to hold the eyelids open. With the standard approach, the surgeon then cuts a thin flap on the corneal surface and folds it out of the way. Next, a laser corrects the shape of the cornea. Then the surgeon replaces the flap over the cornea and removes the speculum. In this myopic eye, the new corneal shape provides proper refraction. With a newer approach, the surgeon prepares the eye in a similar way, then uses a laser to create the corneal flap. After folding the flap to one side, the surgeon then uses a second, cool laser to reshape the cornea, then repositions the corneal flap. In this hyperopic eye, the new corneal shape corrects the refractive error.
Quiz time. Which intervention uses an extremely cold probe to remove a cataract? A. Blepharoplasty. B. LASIK. C. Laser retinal photocoagulation. D. Cryoextraction. One volunteer at the time, please.
The ear is divided into three anatomical parts: the external ear, the middle ear, and the inner ear. The external ear consists of the auricle, or pinna, and the external acoustic meatus, or auditory canal, a canal that is about 3 centimeters long. Sound waves enter the external acoustic meatus and travel toward the middle ear. The tympanic membrane is between the external acoustic meatus and the bones of the middle ear, the malleus, incus, and stapes. These bones are connected to each other. The auditory or eustachian tube extends into the nasopharynx. It serves to equalize air pressure against the tympanic membrane to prevent rupture. The tympanic membrane starts vibrating when sound waves strike it. This vibration causes the handle of the malleus, which is attached to the membrane, to move. This, in turn, moves the incus, which moves the stapes against the oval window into which it fits. The inner ear is also called the labyrinth because of its complicated shape. The bony labyrinth consists of the vestibule, cochlea, and semicircular canals. Inside the cochlea is the cochlear duct, a membranous sac filled with fluid called endolymph. Between the cochlear duct and the bone of the cochlea is a fluid called perilymph. The organ of Corti is also located in the cochlear duct. It has hair cells attached to a basilar membrane. They are topped by the tectorial membrane. When the membrane of the oval window vibrates, it causes the perilymph and endolymph to move. Movement of the endolymph causes the basilar membrane to vibrate, and movement of the hair cells against the tectorial membrane generate impulses that travel along the cochlear nerve. The nerve impulses travel to the brainstem, then up through the thalamus to auditory areas of the cerebrum, where they are interpreted as sound.
The auditory tube or eustachian tube leads from the middle ear to the pharynx, throat. This tube can prevent damage to the eardrum by equalizing pressure in the middle ear with the atmospheric pressure. Now, we will study some word parts pertaining to the ear. Acousto and audio pertains to hearing. The adjective for acousto is acoustic. Adenoido refers to adenoids, auro, auriculo, and oto relates to the ear. The adjective for auro is aural. For auriculo is auricular, and for oto is otic. Ceramino refers to earwax. Cochleo pertains to cochlea, and its adjective is cochlear. Myringo and tympano relate to the eardrum. The adjective for tympano is tympanic. Salpingo refers to the eustachian tube, and the suffix ori means pertaining to. Let's review some diagnostic terms for the ear. Audible means capable of being heard. Auditory pertains to the sense of hearing and the involved organs. An otoscopic examination is the same as otoscopy, which is the examination of the eardrum and other parts of the external ear with an otoscope, the instrument. Let's continue reviewing diagnostic terms for the ear. An audiometer is an electronic device for measuring hearing, and the process of measuring hearing is audiometry. An audiogram is the record produced. Audiologists are specialists in hearing. They detect and evaluate hearing loss and determine what is best for the patient's hearing. Deafness is the inability to hear. Tuning fork tests screen for function of the auditory nerve and ability of ear structures to conduct sound waves to the inner ear, and the sound intensity is measured in decibels.
Quiz time! Which word part refers to the yellowish-brown waxy substance that lubricates and protects the ear? A. Acousto. B. Myringo. C. Salpingo. D. Cerumino. One volunteer at the time, please.
The ear has three divisions: the external ear, which includes the ear canal, the middle ear, which includes the tympanic membrane or eardrum and the eustachian tube, and the inner ear, which contains the organs of hearing and balance. The middle ear is prone to infection because the eustachian tube connects the middle ear to the nasopharynx. Otitis media is an infection or inflammation of the middle ear. It usually starts when organisms that cause an upper respiratory infection move up the eustachian tube and into the middle ear. The eardrum becomes inflamed, causing pain and redness. Exudate from the infection also pushes on the eardrum, which increases the pain. If excess exudate builds up, then it can rupture the eardrum, causing fluid to leak into the ear canal and possibly leading to hearing loss. If fluid pressure becomes excessive, then the patient may need a myringotomy, which involves an incision in the eardrum to relieve pressure and to remove middle ear drainage. A myringotomy is done to prevent spontaneous rupture. A tympanostomy may be required, during which a tube is inserted into the eardrum to promote long-term drainage and to reduce the risk of infection. Bacterial otitis media can also lead to other complications, such as mastoiditis or meningitis, but these complications are rare.
We need a couple of volunteers to determine the meanings of the following terms by analyzing the word parts: otalgia, otorrhea, otitis, externa, otitis media, mastoiditis, otosclerosis, automycosis, and myringitis. One volunteer at the time, please. Other diseases and disorders of the ears are tinnitus. Tinnitus is noise in the ears, is one of the most common complaints of persons with ear or hearing disorders. The noise includes ringing, buzzing, roaring, or clicking. It may be a sign of something as simple as accumulation of earwax or cerumen, or as serious as Meniere's disease. Meniere's disease, a chronic disease of the inner ear that can include episodes of hearing loss and vertigo, as well as tinnitus. Vertigo means dizziness.
Hey there, folks. Today I'm breaking down 3 common ear surgeries that you might encounter as a medical interpreter. First up, we've got the cochlear implant. This surgery helps folks with severe hearing loss by bypassing damaged parts of the ear and directly stimulating the auditory nerve. The surgeon makes an incision behind the ear, then inserts a tiny electrode array into the cochlea. Once activated, this device can send sound signals straight to the brain. Next, let's talk about otoplasty, often known as ear pinning. This procedure is usually done to reshape or reposition prominent ears or to fix deformities. The surgeon makes a small incision behind the ear to access the cartilage. They then sculpt or remove parts of the cartilage to achieve the desired shape. Finally, the ear is pinned back closer to the head with stitches. Lastly, we have tympanostomy, commonly referred to as ear tube surgery. It's typically performed on children who suffer from frequent ear infections. Here, the surgeon makes a tiny incision in the eardrum and inserts a small tube. This tube helps to ventilate the middle ear and prevent fluid accumulation. Understanding these procedures is crucial for accurate and empathetic interpretation. So, whether it's a cochlear implant, otoplasty, or tympanostomy, now you're a bit more prepared to assist in these medical settings. Thanks for tuning in.
Some non-surgical interventions are antibiotics, which are used to treat bacterial ear infections, and cerumenolytics that are used to soften and break down earwax.
Now, we will learn about the special sense organ receptors: the eyes, the ears, the skin, the mouth, and the nose have receptors that detect sensations, and the information is then transmitted to the brain. The receptors are nerve endings that enable us to see, hear, feel, taste, and smell. Nociceptors detect painful stimuli. Keep in mind that the combining form, noci, means to cause harm, injury, or pain. Chemoreceptors are nerve endings that detect chemicals. The combining form chemo refers to chemical. Taste buds contain chemoreceptors for sweet, sour, bitter, and salty taste. The nose and tongue have chemoreceptors that detect chemicals. Mechanoreceptors are sensitive to mechanical changes in touch or pressure, such as those in the ear. Let's also keep in mind that the combining form mechano means mechanical. The eyes contain photoreceptors that detect light and are responsible for vision. As we mentioned in previous sessions, photo means light. Thermoreceptors, located immediately under the skin, detect changes in temperature, and thermo means heat. The sense of touch and pain are initiated by special receptors that are widely distributed throughout the body.
Olfaction is the sense of smell. Olfactory is pertaining to the sense of smell. And osmia refers to the sense of smell too. Now we need a volunteer to analyze and describe for us the meaning of anosmia and hyperosmia. One volunteer at the time, please. Quiz time. Which word means pain receptor? A. Photoreceptor, B. Nociceptor, C. Chemoreceptor, D. Osmoreceptor. One volunteer at the time, please.
Abbreviations. dB stands for decibel, the measurement of sound intensity or loudness. LASIK, laser-assisted in situ keratomalaeus, corneal surgery in which the excimer laser and a microkeratom are combined to correct myopia.
Chapter 14. Special sense organs of the peripheral nervous system. Drug class. Effect and uses. Anti-glaucoma. Ophthalmic agents. Lower intraocular pressure to prevent further loss of vision due to glaucoma. Subclasses include alpha agonists, beta blockers, cholinergic agents, miotics, carbonic anhydrase inhibitors, and prostaglandin analogs. Example: brimonidine, alphagan; carbachol, myostat; dorzolamide, trusopt; latanoprost, xalatan; timolol, timoptic; travoprost, travatan. Ceraminolytics soften earwax to make it easier to remove from ear. Example: carbamide peroxide, D-Brox. Cycloplegics paralyze the ciliary muscle to allow examination of the eye. Many of these agents also act as mydriatics. Example: atropine, atropisol; cyclopentolate, cyclogil. Miotics constrict the pupil of the eye. Example: pilocarpine, isoptocarpine. Mydriatics dilate the pupil of the eye. Phenylephrine, cyclomydril; tropicamide, mydriacyl. Ophthalmic immunomodulators increase tear production. Example: cyclosporine, restasis. Ophthalmic lubricants relieve dryness of eye or irrigate eye carboxymethyl cellulose. Refresh tears. Example: polyethylene glycol, propylene glycol, cysteine. Do you have any questions, comments, or concerns that want to share with us?
Thank you so much for joining us in today's session. Your active participation is greatly appreciated. If you have any questions, concerns, or suggestions for enhancing our online sessions, please don't hesitate to reach out to us. We are dedicated to ensuring that your learning experience is as enriching and effective as possible, and we're more than happy to accommodate your specific needs. In the meantime, we encourage you to take some time to review the video, explore your ebook, and engage in the online practice exercises and tests. We eagerly anticipate reconnecting with you in our next online session. Wishing you a delightful remainder of the day.